I'm David McGuffin in Kenya with the story of a Canadian AIDS researcher who's harnessing Africa's cell phone revolution to improve medical treatment and save lives. Eunice is HIV positive. A year ago, the widowed mother of 2 young children weighed less than 80 pounds. She was close to dying. Antiretroviral treatment, or ARVs, made her feel ill. She shied away from the drugs. Then she joined a Canadian-developed program which is using cell phones, cheap and popular in Kenya, to encourage AIDS patients to stick to their medicine. It's producing incredible results. The idea of using cell phones to help treat AIDS patients was developed 3 years ago by Dr. Richard Lester. He noticed cell phones being used everywhere in Kenya, no matter how poor or remote the region.
Cell phone use is very inexpensive. It's very cheap compared to back home in Canada. The cost of sending an SMS is the equivalent of a few cents now. It's a very competitive market here. The cost of even voice calls, again, receiving them is always free.
At times I would forget to take the drug, and I might not have the bus fare to come up to this clinic because I come from far, and I found I maybe have 5 shillings talk time. So I would talk to them, and it saves my time and money.
A recent government study found that patients in the clinics where the cell phones are being used were 2 times more likely to stick to their antiretrovirals than those at clinics without the program. This is key because irregular use of ARVs can cause drug resistance, which means moving to more expensive medications.
In me, I felt loved and taken care of.
The hope now is to find funding to expand this program to all of Kenya and beyond, so many more people like Eunice can benefit from it as well. David McGuffin, CBC News, Nairobi.